Welcome, Samuel, on the me&my Health Up podcast show. How are you today?
Fantastic, Anthony. Been a long time, but good to be back on the podcast.
It's so great to have you back on the show. The one we did on the vagus nerve for digestive and mental health has been a real hit. It's in the top 5 of my recordings, and having recorded over 130, I think that's a great episode that we recorded together a long time ago.
Yeah, it was a really good episode, and that was just scratching the surface. Since we've spoken last, so much more has changed. There's so much more literature that's come out and different ways of testing and treating. So, yeah, that was a really good preliminary introduction to it, for sure.
We'll definitely do a part 2, Sam. So keen to do a part 2 on the vagus nerve with you. And just for the listeners that didn't hear your episode on the vagus nerve, please share with them how you've arrived at where you are today as a musculoskeletal therapist.
So basically, as working in musculoskeletal therapy, a lot of people were coming into me with chronic pain issues. It's my job as the clinician to treat those pain issues. And I knew that they had sleep problems because they're reporting it to me. And I knew that if I wasn't addressing their sleep or addressing their sympathetic nervous system, that their pain is likely to stay quite elevated. So that's where the vagus nerve came in. And it's just a really good integrative tool for repairing people's sleep, regulating their inflammation, and basically changing the way their brain perceives the pain. So it just played a very vital role in trying to treat more of the root causes and less of just manual manipulation or manual therapy to the peripheral limb. Yeah, a bit more of a central nervous system approach.
Okay, so you've really noticed that your clients are really sympathetic dominant in terms of that fight or flight state, and hence you've looked for supporting toolkits in your musculoskeletal area to support the clients essentially restore balance and heal so that the body can heal itself. And the one we're really keen to chat about today is one that's becoming a bit more popular, and certainly, the influencers are onto it, is the laser therapy. So really keen to for you to, I guess, explain to the listeners what laser therapy is.
Okay, so laser therapy, although it may sound a bit extreme, is very safe. And as a matter of fact, there's about 75 years of research. So research first began in 1950. And it sort of began with a scientist who had some rats with some tumours. And what he was trying to do is he was trying to see if this red light or even infrared light would grow the tumour. And he was lasering these rats with the tumours. And what he was noticing somewhere throughout the study, which was not his intention, was he had to keep shaving these rats, the rats that were getting the laser, in comparison to the ones who weren't getting the laser or the red light. So he thought, okay, well, this is interesting. This is obviously growing or doing something. What else does it do? And that's where it sort of went down that direction for what does it do?
And just in terms of laser, so people might not be familiar with where laser fits on the light spectrum. Essentially, some people call this low level light energy or low level light therapy. So just sort of give some sort of context of where the laser fits on the light spectrum, so that people can understand that essentially what they're, I guess, learning about. Yeah.
Okay, so what's important is what sort of light or what wavelength they're using with laser. So now low-level laser therapy or photobiomodulation basically involves usually infrared or near-infrared. And depending on the laser that the clinician has or the intention depends on whether they'll choose red light or whether they'll choose infrared light. Now, again, this can be done with LEDs, and sometimes I use the word laser therapy interchangeably. Sometimes I'm actually referring to just LED therapy, but it's the same wavelength, the exact same therapy, except for laser is just more concentrated. It's a lot brighter. It's just got a better ability to reach deeper depths. Where it sits, usually when we're talking about something for beauty, we're talking about that 640 sort of nanometer, and that's the sort of wavelengths you'd be experiencing or expecting in, like, I don't know if you've seen those face masks. There's like these face masks with LEDs, and they're basically improving collagen production. And they're good for that because their depth of penetration is quite, it's very just below the skin, doesn't have very good penetration, but perfect for that. But for instance, if you've got pain or you're trying to do maybe the therapy on your thyroid or something inflammatory, then you're really going to need something like 808 nanometer or above. You can even get them up to 940 into the thousands. One misconception with low-level laser therapy is that more power is better. And that's not necessarily the case, and I don't see that clinically significant when I'm seeing patients. As a matter of fact, the laser that I'm using is a high-powered laser. But I don't use much high-powered laser. I tend to turn my power output right down just because a lot of the research and a lot of the benefits I've seen have been really with the lower power outputs, lower frequencies for different conditions.
Yeah, so it really depends on, I guess, the frequency you use based on the condition you're treating and the level of depth that you need to get down to. So whether you're, working on that beauty or skin or alopecia, which I might need a bit of help with. So yes, yeah. And then if you're working more deeper into muscle tissue or, and I know you work with initiating the stem cells.
So basically the way photobiomodulation works, I'm going to refer to this from now on because that's what they refer to it now in the literature. Photo meaning like photons, like photons of light. Bio meaning like biological tissue. And modulation is the ability to modulate something. If it's too low, it comes down. If it's too low, it comes up. If it's too high, it comes down. And this is what the therapy is doing. It's photobiomodulation. It's photons of light that interact with the biological tissue and modulate it and correct it when there's some sort of discrepancy in homeostasis. Now, the way it works just like photosynthesis. So if you imagine that in photosynthesis, you've got these plants, particularly the leaves, they're absorbing energy from the sun. Now, there's a part in the leaf called chlorophyll, and it's the chlorophyll that's absorbing the photons of light from the sun, and it's transforming that energy from the sun into energy for the plant. Now, that's the same way it acts in the body, except we have a mitochondria. So in all of our cells, even the cells of animals, they have a mitochondria. And it's inside that mitochondria a part called cytochrome oxidase C. It's able to absorb the energy, the photons of light from the laser, or the LEDs, and it uses those photons to repair the function of the mitochondria, improve the function of the mitochondria. And that's the primary mechanism, but pretty much whatever you point this therapy at, it improves. So if you've got a histamine response, it's going to be antihistamine. But if you've got issues with gut lining and you're trying to initiate maybe some histamine to repair the gut lining, it's going to do that. It's modulatory.
Yeah, so essentially it enables the body to heal itself. It's that enabler. Would you say that?
Yes, it enables. A lot of things have low mitochondrial function. There's low energy states and regions. And you've got to imagine that if I bring it back to like a sports injury perspective, if you roll your ankle and you tear the ligaments in your ankle, the cells in that ligament that have been ruptured are damaged. The cells are damaged. But on a bit of a deeper level, the mitochondria has been damaged in those cells. And the function of the mitochondria is to produce energy for the cell. So if you've got a poor or damaged mitochondria, it's not able to produce energy efficiently for the cell, and that's going to directly correlate to the speed of recovery. So, you can laser a ligament injury from day one, any sort of injury. It's never too early for laser, particularly if we're doing low-level laser, which is, low power output. I actually bring it along to some of the large sporting events I do. So I brought my laser along to I was at nationals with Hockey Australia, doing the hockey team, and they might get a hockey ball to their ankle, come on the sideline. I've got the laser there. I'm lasering it, trying to reduce some pain, trying to manage the inflammation. So it's never too early for laser, and it's got such a wide application. Like, you look at the papers on it for photobiomodulation for the microbiome in the gut, and it only increases the biodiversity of the good bacteria. It's quite like, how does it know to do that? Well, it's because the cells know what needs to happen. So when you improve the function of the cell, it's going to go off information, and it's going to do what it needs to do. There's so many topics that we'll cover today. Do you have any questions about, because I've said a whole bunch of stuff. I don't want to go down this whole rabbit hole, and you're like, well, I just want to touch on that.
No, absolutely. My next question was, in terms of what ailments have you seen it work really well for? You've mentioned the skin, you've mentioned thyroid, you mentioned sporting injuries. Sporting injuries then brings up to me recovery from surgery. Yeah. It could be beneficial in terms of speeding up that recovery from surgery. So, really keen to get into all the areas that you're supporting your clients in and the results you've seen. Maybe share some case studies.
Oh, fantastic. So let me talk about a study that they did on heart attacks. That was for myocardial infarction. Now, when they were doing this study, they did photobiomodulation to the heart post-heart attack, and they saw that, there's some improvements there. It definitely does protect the heart and improve the repair of the heart. But then they also, in that same study, did some application of the laser to the bone marrow. Now, bone marrow is in large bones. So things like the tibia, things like the femur, the sternum, humerus. But when we're doing the therapy, and what they did in the research was they utilized the tibia just because it's thin skin and then bone. So really good exposed area we can get the light onto. And they did bone marrow laser on the tibias and sternum. And what they found was there's an increase in circulating mesenchymal stem cells by 500%. And what they found in that research was it actually reduced the size of the infarct, the size of the heart death, by 50%. And I took that research. I thought, well, that's quite groundbreaking. And for a number of years now, I've been applying that to sports injuries and reconstructive surgeries. So people having knee replacements, ACL replacement, even just broken bones. And for instance, I had one case study a couple of years ago where a patient had an ACL replacement, and from day one, we were doing bone marrow laser, spike the stem cells. We were lasering his lymph nodes to help drain the swelling, and we're lasering the nerves and the pain around the knee. Now, at a week and a half post-op, he was able to bend his knee beyond 90 degrees. Now, conventionally, the usual time period is you've got 6 weeks in a full leg splint, and then the physiotherapist or the clinician has then got another 6 weeks to try and get your knee to bend 90 degrees. Now, we got this at a week and a half, and then at 2 weeks post-op, I had him doing body weight deadlifts and quarter squats. Again, that's something that you'd usually see at week 18, week 19. I thought, that's marvelous. And I've had other people come in who basically saw that story and were like, well, I'm actually getting some surgery. I'm getting a hip replacement. You can do mesenchymal stem cell prepping, and that's bone marrow laser every day for 4 days pre-op. And it really is a great way of supporting the body to have the best recovery. If you know where they're going to do the incisions, we can do some photobiomodulation at those incision sites. The wound's going to heal a lot faster. Heaps of stories. I've had multiple people with fibular fractures, and every single one of them at 2 weeks fracture. Now, this isn't with surgical intervention. This isn't where they've had, titanium plates and screws. This is just a fracture where they've immobilized it and they've left it. 2 weeks. 2 weeks post-fracture, I've had them get the X-ray again, bones fully united, which is really good. So you really can speed up recovery. Pretty much whatever you point the laser at, it does improve, but there is a science to it. You don't want to overstimulate. So you don't hit the same point twice. More isn't better. And this sort of relates to why there's been such a long duration of research, and it's only now that we're sort of working it out. So initially, when the guy worked out that lasering or doing the LED on the rats grew the hair, they went, oh, great, well, we know it grows something. We'll do long durations of time. We'll do high power output. And the problem is it doesn't work like that. And essentially, you're trying to force feed the cells or the mitochondria all this energy, all these photons. You can't consume it. You can't absorb it. It starts spitting it out. Sort of like if you're going to fill a cup up at the tap and you put the tap on full blast, heaps of water goes in that cup, but heaps of it comes out. So you need to, let the water go in at a normal rate, control it, and you turn it off, and you haven't spilt anything. Same sort of analogy applies to laser. So instead of administering, let's say, 30 joules of energy for a site over 15 seconds, it works better if you take a minute to do it. You take a whole minute and let the joules get absorbed. Is much better. You've got applications for brain. I've got a patient at the moment she's coming in for transcranial laser. She had a brain tumor and she had that brain tumor removed. And then during that surgery, she actually had a stroke. So a lot of rehab after that. But what we're doing is lasering her bone marrow. I'm trying to spike her mesenchymal stem cells. I'm spiking her red blood cell production. And I'm doing the laser directly over the skull, doing it onto the brain. I'm doing, the carotid arteries as well, blood supply to the brain. And what we saw in about 2 weeks is she's just a bit faster. She's a bit faster when she's talking. When she's communicating, she's quicker and it's more succinct. Okay, you can tell that it's not as challenging or a strain. Now we're just working on her energy levels, trying to get her energy to last a whole day until it's time to go to bed, instead of sort of hitting 1 o'clock and being really exhausted. But you expect that. She's had a major brain surgery and a stroke at the same time. So, it's got its limitations, the therapy, but it's all about how you use it. If you're smart how you use it and the practitioner has been trained, then they can really utilize it.
Yeah, that was my key takeaway, is certainly need to see a trained clinician who has experience. You can't just go to the shop and buy a laser and be able to apply it yourself. It's not going to work that way. You really need someone that knows what they're doing.
Well, that's the thing. I've had a few patients say, I've had laser before. It didn't work for me. And okay, well, how long were they doing per point? 5-6 minutes. There's over 70 years of research. Now, for the majority of this research, and I'm talking 60 years of this research, they were doing it wrong. And clinically, it only had a 30% significance. So 30% wasn't, is it working, is it not working? Not enough to basically scream it from, the hilltop and get it brought into every healthcare practice. But if you look at the more modern research where they're using less power, longer durations, it's very biostimulating. It's ridiculous. I've been using this on dogs with arthritis. It's almost like a party trick. Person comes in, I've got this pain, do the laser. I go, okay, now just move it, and they're like, it's nearly gone. That's ridiculous. That's a magic wand. But then I've actually played around with it. I've done more power output, and it doesn't work as well. It really doesn't. I go, okay, well, instead of me taking a minute, if I could really get this done in 15 seconds, and if I'm doing, 15 points at a minute each, if I can make that 7 minutes, I'll try it. It doesn't work. It doesn't work. You can't cut corners with it. You have to take the duration that it needs so the cells can respond appropriately.
And as you said at the beginning, it also depends. Like you apply different frequencies depending on what you're treating. So you also got to know that frequency band that's going to work in, and where to apply it, and how long. And so it's there's a real science and art to it in terms of what you do.
It is, and it's very interesting in regards to transcranial laser. So a lot of the earlier transcranial laser that I was doing for things like anxiety and depression had quite a high hertz. I was using sometimes like 20 kilohertz transcranially. But when I do vagus nerve stimulation, when I'm doing vagus nerve stimulation, for anxiety, I'm doing things maybe like 20, 15 for anxiety. For depression, the new research is showing 30 hertz for depression. But then you do the laser, and it was a much higher frequency. The more modern research is actually correlating now. So 30 hertz for depression, transcranial, matching the 30 hertz for vagus nerve as well. So it's good. It's all coming together. It's making a lot more sense why there's no real difference. It's just the frequency. So, for instance, if someone's depressed, you need to bring them up. You need to stimulate them. That 30 hertz is quite appropriate. But if someone's quite anxious, and they need to be sort of chilled out or brought down a bit more, using 10, 15 hertz. You don't want to stimulate them so much that they have some trouble sleeping. Like sometimes you do too high of a frequency and they go, what, I felt good, but I actually had a bit of trouble getting to sleep. Like it was too stimulating. So it does have a direct effect on the brain. And unless you're doing something like let's say like dementia, higher frequency, let's try and really ramp up activity, improve blood supply, and get some more cerebral oxygenation.
Yeah, I was going to ask about dementia and also Parkinson's, and you've obviously just touched on them. And I know you were working with a client that you had great results using a combination of vagal nerve stimulation as well as laser. You want to share a bit about that story with the Parkinson's client?
Yeah. So this was a patient diagnosed with Parkinson's, okay? Whether he has Parkinson's is another story. I definitely didn't go out there and cure Parkinson's. Let's just make that clear. But he presented like Parkinson's. He had a diagnosis of Parkinson's. He did appear, he was stooped, he had issues with movement. Basically, his right side was affected. He couldn't use his right arm very well. He could, if he really worked, he could kind of lift his arm, but that was it. And the same with his leg. He had to sort of drag his foot, bit of a shuffle. And it was induced by long-term antipsychotics, essentially. And he came to me wanting to see if maybe some vagus nerve stimulation could help. I did some transcranial laser along the motor strip. I don't know if people out there know the homunculus, but trying to target arm, foot, leg regions. And I did some transcutaneous vagus nerve stimulation as well. And we did some for anxiety. Because he did report that he had anxiety. So I thought, okay, well, let's try and get some anxiety down. So at least if you're sleeping better, that's going to help the body. But while he was in here, I said, well, let's try Parkinson's setting. Let's try, quite a high frequency with the vagus nerve. And it was probably 5 minutes in. He said, I'm getting this tingling through my body. I was like, that's quite interesting. Just keep me informed with what's happening. And he started crying. I'm like, okay, is everything okay? He's like, I just feel this overwhelming feeling of joy. Like, I don't know what it is. I've just got this feeling of joy, like flooding through my body. So, okay, well, let's have a look at that arm. And immediately, I've got it on video, I was able to move his arm a lot better. So, okay, so we keep the vagus nerve stimulation on. I'm getting him to catch a ball with one hand and just pass it back to me. We're trying to train him. But the second session, I had him playing soccer with me in here at the clinic, and I was testing him. I was not taking it easy. I was kicking it at different angles and trying to see how he would adjust. And he was making it. I said, this is quite remarkable. And I've personally only seen this twice with him. I had another Parkinson's patient who did have Parkinson's when I was seeing down in Sydney, and just watching this patient get on the bed, quite difficult. It takes a bit of time for him to get his stability right so he can get on the table, did a bit of vagus nerve stimulation, and it was definitely an ease of movement. So he found it a lot easier. He was able to get up in half the time. And yeah, there's just so many applications. It's crazy. It's really exciting. It's really exciting. And all this stuff's non-invasive. There's no side effects. Like you wouldn't point the laser in your eye, but, you sort of hear when you're a kid, don't point lasers in your eye. So, you should already have that common sense.
Now, I was just going to ask, I'm seeing a lot of chronic fatigue and insomnia, as a result of, getting through the pandemic or still trying to get through the pandemic. And just wondering, have you seen clients and treated them with photobiomodulation, insomnia, chronic fatigue? And where, for me, it's sort of, where would you treat them with the laser for, let's say, insomnia and chronic fatigue?
Okay, so it depends on what you think is the root cause. Do these people have issues with cortisol? Is their cortisol melatonin sort of swapped around, or do they have cortisol resistance? Do they report that they've got systemic pain? They're quite tired, and then you do blood work, and their cortisol appears normal or even elevated. If they've got cortisol resistance, then you'd be leaning towards some vagus nerve stimulation. But in regards to laser, I'm lasering under the tongue, so sublingual laser. And we got that evidence from rheumatoid arthritis research where they did some sublingual laser. They found a systemic anti-inflammatory effect. I'm also doing laser on the brain stem as well. I'm doing about 1.5 minutes per point along there. And then with vagus nerve stimulation, I'm trying to improve the vagus nerve's input to the brain so the brain can regulate the neurotransmitters better, because vagus nerve is very sensory. And a lot of the time with stress, a lot of people lost their jobs, some people had to sell their houses through the pandemic, and all that stress directly inhibits the vagus nerve. And depending on, viruses affect the vagus nerve. If you did in fact catch COVID, or even if you've had a history of getting shingles, glandular fever, really down-regulates vagus nerve. So when you improve the vagus nerve function, you're able to deal with the stress better, because not all the time you can eliminate the stress. If you have lost your job and that's your main source of income, there's not much you can do in that short period of time apart from improve the way the body responds to the stress. And that's what we do with the vagus nerve stimulation. That's what we do with the transcranial laser. For mental clarity and brain fog, I'm doing frontal lobe right here. Things like anxiety, I'm doing the left dorsolateral prefrontal cortex. That's quite useful in anxiety. And the right side in schizophrenia seems to be promising.
And you mentioned the what it does to the mitochondria of the cell, and I'm thinking in some of these cases of chronic fatigue, it's down regulated mitochondrial function. So where would you apply it for a chronic fatigue person? Is it, again, going back to what's driving that chronic fatigue? And as you said, it could be high cortisol for long periods of time, cortisol resistance, and hence is that where it goes?
So I wouldn't be using laser in isolation. So, it really does need to have a holistic and an integrative approach. But you can use it as a great adjunct treatment to improve the systems of the body. For instance, if you're taking some supplementation to improve maybe gut inflammation or trying to get better absorption of the nutrients, well, if you've got excessive gut permeability, if you've got quite an inflamed gut, you're not going to get the best results from that. So you can even apply it to the gut, but predominantly for chronic fatigue, I'm doing brainstem, I'm doing carotid arteries, I'm doing under the tongue, I'm doing the brain right in the middle, and I may do some bone marrow, but a lot of the research for chronic fatigue and stuff like that, it's really just brainstem, under the tongue, and carotid arteries.
Yeah, cool. So, Sam, how can the listeners best connect with you? I'm sure they're thinking of a loved one or someone they know, or it could be themselves, in terms of this may be the thing I need. I've been looking around, nothing seems to be working. This could be it. So, a bit of laser therapy, a bit of vagus nerve stimulation. So how can the listeners best connect with you?
Okay, so at the moment, I'm based out of the Gold Coast in Elanora in Queensland, but monthly I'm going down to Maroubra Junction in Sydney. I'm seeing patients there, and I'm also going down to Melbourne and Victoria and seeing patients there on a monthly basis. The best way is to go to my website, which is www.recuperatehealthandwellbeing.com, or maybe give me a follow on Instagram, recuperate_health. Now, just to touch on a few things with the laser, you can't feel it. So you don't feel laser. It doesn't burn. So if there's any concerns around that, no, you're not even going to feel the laser. And it's quite marvelous, actually.
And for the listeners that are overseas, there's a US listener base. They could get in touch with you, and you could help them out in terms of finding someone that could support them over in their area.
Look, I currently am seeing patients in the United States. I've got some patients in Singapore, in New Zealand. So when it comes to things like vagus nerve stimulation, and even musculoskeletal therapy, I've been treating a lot of neck instability over Zoom. When it comes to laser, I can put you in the right direction, because you just want to make sure that you're getting the right wavelength of laser. If you're going in for pain and you're getting a wavelength of 640, well, it just doesn't have the depth, and there's no surprise when you don't get the improvement.
Yeah, so listeners, if you're struggling and you think there's another element of holistic care that's missing in your support, then Sam's the man. Go for him. He could certainly help point you in the right direction, or actually give you the right treatment. So thank you so much for coming on the show again, Sam. Really appreciate your time and sharing such great wisdom around this photobiomodulation. I've learned a lot, and I'm sure the listeners have.
Yeah, thank you. It's been a pleasure. I look forward to part 2 of the vagus nerve chat.
Yeah, I can't wait, Sam. And to the listeners, thank you for tuning in to another insightful episode of Me and My Health Up. Stay tuned in. And if you think there's someone out there that could really benefit from Sam's knowledge, please share the episode with them. We'd love to get it out there so that we can enhance and enlighten the well-being of others. So thank you once again.
Thank you.